Let's get into it. Let's hear from each of your landscapes about what's going on in your current state of affairs when it comes to GLP-1s. Let's hear from you, Dr. Sarah.
Sure. Can you hear me okay? Yeah.
I think so.
Okay.
Yeah.
So, we started, the landscape started over 20 years ago. So I think people have this misconception that GLP-1s are new. They are not new. These are drugs that have been well established and studied for over 20 years now. They started with the diabetics, right? They have changed diabetics' lives for the better. Then we moved on to the obesity indication, where we were seeing people with obesity, being overweight, have a complete life transformation, top down. I'm a neurologist, right? But I also am an obesity medicine specialist. And so I have seen people have a reduced risk of dementia, of Alzheimer's type dementia, vascular type dementia, of just general brain fog, decreased inflammation in their bodies, and decreased risk of over 13 types of metabolic cancers, okay? Because these drugs are miracle drug of our time. But then with your question about the landscape has now changed, and people who are now normal BMI, who aren't necessarily diabetics, who aren't necessarily overweight or obese, are microdosing GLP-1s, and that term is a little bit elusive still to some, but the now normal BMI people using GLP-1s to reduce food noise, to reduce inflammation, to make better food choices, and to also improve many markers of their health is the new thing that we're seeing growing and expanding. And that is really, really exciting. And that's probably a huge population of people that I see is people that really just want to optimize their health and increase their longevity, and not necessarily now just having obese and overweight people using this. We're really expanding the population and the use cases of GLP-1s, which is exciting.
Very exciting. Love that there are many different use cases. Let's hear a little bit more from Sarah on what does GLP-1 actually do when it comes to reward pathways, metabolic signaling. Let's get into the science of what GLP-1s are doing.
Yeah. Okay. You said 2 minutes. Gonna be tough under 2 minutes, especially because I also wanted to sing a song. So I'm just kidding. People ask me this question all the time, like, how did you get into GLP-1s? You're a neurologist. And the reason is because I scan people's brains for a living. And every single day that I was looking at brain MRIs, I was seeing, and I was reviewing with my patients, something called small vessel white matter microvascular ischemic disease. And everybody would come to me and say, what the hell are these little white spots on my brain, doc? Does that mean that I am going to get dementia? Am I going to end up with memory issues? And I can guarantee that a large portion of you guys, if you were to go get a brain scan, you would have white spots on your brain MRIs.
No.
Yeah, a lot of us would. And when these little white spots become larger and more confluent, they can, in fact, affect your ability to think, function, and they can cause brain fog, and they can increase your risk of various types of dementias. So why do we get white spots? We get white spots, one of the main reasons is because of sugar affecting our blood vessels. Our blood vessels that feed the deep parts of our brains are extremely fragile and susceptible to damage. And sugar is one of the most damaging things to these very fragile small blood vessels. So, insulin resistance is something that causes inflammation in our bodies. It damages our blood vessels. In neurology, we know it damages our nerves, and people get these nasty neuropathies and all kinds of damage from that, right? So if we can increase insulin sensitivity in the brain, and we can reduce the blood sugar damage on these small blood vessels, you can directly see a correlation with decreased white matter spots and increased brain function, which is so exciting. And that's exactly why I didn't pivot. I still practice as a neurologist, and now I'm also an obesity medicine specialist and run Dr. Brain RX, because GLP-1 drugs are brain drugs, okay? They are brain drugs. They work on the brain to agonize GLP-1 and GIP receptors to help preserve brain health, to keep the integrity of our white matter tissue strong and full, to prevent your brains from shrinking, And then the other really cool thing is what you mentioned, which is the dopamine reward circuit. So really awesome is the ability for these drugs to balance our dopamine reward path. So when you are constantly craving a food, right? Like I have crazy food noise. I'm a skinny girl. I was born skinny, whatever, but there's a way to be skinny fat. And at one point I really was skinny fat because I wasn't doing the right things. But I was ravenous if there was a charcuterie board like that around. And I've already talked about this. I am a snacker. I love a processed food. And anytime you grab a processed food, what happens? You have a surge of dopamine. And that's what causes the addiction to food. So these medications work at a brain level to cut that terrible cycle of addiction, dopamine surge, food, and to allow you to have less food noise. You're not thinking about food constantly. You're not addicted to it anymore. You have the ability to make better food choices, which is why we're seeing in people who have binge eating disorders a really strong improvement where they're now not obsessed with food. They're just eating in a more balanced, normal way and able to make better food choices.
Amazing.
Beyond that, we're seeing this insane improvement in markers of inflammation. Like when we do blood work and we see someone's ESR, their CRP, these blood markers that show that your body is inflamed, we're seeing those markers decrease because of GLP-1s, even in people who are microdosing. It's awesome. So preservation of brain health, balancing the reward circuit, even seeing improvement in people being addicted to nicotine and alcohol in addition to the processed foods. Decreased inflammation, brain and body, super cool.
Amazing. Sarah, we're going to get into, and let's talk about long-term use, and let's talk about long-term use of GLP-1s. And I'm sure you get this question all the time, like, when should you stop? When should you not stop? What are the effects of long-term use? And if you can share a little bit of that, about that with us.
Yeah, I get this question every single day from patients is, when I start, do I have to be on this forever? Everybody, that's the $1 million question. And the truth is that everybody's GLP-1 journey is going to be so different. Yours isn't going to be yours. It's very, very different. And I tell people generally, though, if you are a person who has suffered with an unhealthy relationship with food, like Kim was talking about, most of your life, you are going to feel so well on this medication, and you're going to feel such a healthier relationship with food that when you do go off, you're going to miss it, and you're going to want to be back on a GLP-1. Now, I think two things. People hate the idea of being imprisoned to a medication all their lives. To be honest with you, it's daunting. It feels like you're jailed to it, like you want to be free one day from a medication. And then, two, they sort of are worried about side effects, right? So if you get to your goal on if my patients get to their goal on GLP-1 and they're doing well and they're thriving, it's always reasonable to start tapering down to see how much food noise comes back. And some of them get off and they do well, and they don't need to be on a GLP-1 forever. Some people lose a lot of weight and their food noise does return because evolutionarily their body thinks that they are starving, and their body wants to pack on more pounds, and so they end up going on a maintenance dose long term. And that long term relationship with a GLP-1 is going to be much better than a long term relationship with high blood pressure, prediabetes or full-blown diabetes, metabolic cancers, premature death, heart attack, stroke, all of those things that you don't want to have in your life, right? Those are people who have for a long time had obesity or been overweight. So I think those questions are really, really important to be answered when you start a GLP-1, when patients start a GLP-1 journey. And the other thing that's really, really important is the dosage, right? Like certain people will start on way too high of a dose, or they titrate up on their dose way too fast, and then they have a rapid acceleration of weight loss, and then they do run into problems like Ozempic face, Ozempic butt, really just terrible wasting, and they don't look well. So it's really important to work with a good team, a good doctor, a good practitioner that's going to monitor the progression of weight loss so that you're not losing too fast, so that you're getting in enough protein macros, you're working with a good dietitian, that you're resistance training. On the contrary, I actually have seen people go through their insurance to an obesity medicine specialist, even who's good at what they're doing, but they're too busy. So they don't see their doctor frequently enough, and they never increase their dose, and they needed to lose like 50, 60 pounds to get to their goal, and they never lost weight because no one ever increased their dose. So it's really important to work with a team that's really going to be attentive to dosage, side effects, and talk about long-term use and a maintenance plan when you do get off.
Let's talk about future state. Who would like, Sarah, if you'd like to go first, like what do you think is going to happen in the future when it comes to GLP-1s, innovations, anything you're excited about too, if you'd like to share?
Yeah, lots of exciting things. GLP-1s have already changed the world. Like truly, they have changed the world. They have changed our health. I think we're going to be living too long now because of them, which isn't a terrible thing because we're actually going to be living with less pain, with less disabilities, right? Like less weight on our spines. I have a friend here who's an orthosurgeon. She knows this. She does this all day long. When you've got a lot of weight on your spine, it compresses your spine. You end up with terrible hip pain, back pain, knee pain, osteoarthritis. So we're going to be living longer, living better. So truly, like we're gonna run into a lot of other types of problems with our longevity now, because these are the longevity drugs of our time. Now we've got other exciting things in the pipeline like Retatrutide. All the gym bros are excited about Reta. On TikTok, they're calling it Ratatouille. It's crazy, but it's a triple agonist. We had semaglutide, which was Ozempic, GLP-1. Then we had tirzepatide, which was GLP-1 plus GIP, even more at weight loss. Now we've got Retatrutide that's GLP-1 plus GIP plus glucagon activism, which means that it works on something called lipolysis. It burns more fat. It's more metabolically active. It's very exciting, and it's almost bariatric surgery level weight loss. 28% weight loss. It's insane. The young guys are using it to shred, and our really, really obese people are literally going to just be losing so much weight, maybe too fast. We've got to be really careful with Reta when it actually does get FDA approved by the end of the year. And then they're doing all kinds of other crazy things, like Eli Lilly is just, I don't know, their stock is already so crazy high. Buy now. But they're also working on something called Bimagrumab. So it's another monoclonal antibody it works on myostatin to help to build muscle in conjunction with GLP-1. So you're losing fat, you're losing weight, you're building muscle. So it's like literally we're just going to live forever at this point. It's wild. It's really crazy. So the future is cool, I guess. I don't know. It depends on how long you want to live, you know?
Now that you mentioned that, I'm gonna have to make some changes in my plans.
Yeah, exactly. Yeah. Freeze your eggs.
Do you have all patients that are going to get on GLP-1s do lab work before, or do you not?
Lab work is not necessary before starting a GLP-1. You want to make sure that the patient doesn't have active pancreatitis, MEN2 syndrome, or increased risk of medullary thyroid cancer, active gut issues, like if they're having some sort of inflammatory bowel disease and they're having uncontrolled bowel issues, you don't want to start a GLP-1 at that time. But labs are actually not necessary. It's nice to see labs. It's really nice to see things like lipid profiles improving over time, A1C levels for diabetes decreasing over time, triglycerides, LDL decreasing, and then the ESR-CRP levels, just inflammatory markers. The way that they trend down on a GLP-1 is so beautiful, so it's really nice to see, but it is not necessary to have lab works before you start.
What supplements would you recommend to maybe, or that you think are great for somebody who is having gut issues in terms of like inner lining, where the inner lining is being affected, or maybe like it's causing skin issues? What do you recommend? Or do you think it's better cured on its own? I don't know.
I'd love to answer this one. For gut inner lining was your question?
Yeah.
Well, it depends on what your symptoms are related to gut inner lining, right? Like, is it acid reflux? Is it diarrhea? Is it constipation?
No.
Right.
If it's like food sensitivity
Food
or
sensitivity.
skin issues.
Yeah, I mean, I don't think that we have a supplement that's directly for that. I will say that in my practice, we do peptides as well. And so BPC 157 is derived from gut tissue. And we're seeing that it really tends to be helpful for people with gut issues because it promotes angiogenesis and oxygen and blood flow to the gut. So people are having really nice benefit with BPC 157 in terms of healing for their joints, healing for their injuries, but also gut. But I don't know, maybe Corey has a better answer for an oral supplement.